I want to bring in Congresswoman Donna Shalala, a Democrat from Florida. She served as the Health and Human Services Secretary under President Clinton. Congresswoman, help us understand this. How do you make the decision to start closing schools, businesses, interrupting public transportation? Are we getting close to that point?
I don't think so, but that's going to be up to public health officials on what kind of a containment strategy they need to do. We certainly need to trace every person who came in contact with anyone in that nursing home. That's the way public health officials try to contain a virus like this. But if it's been around for some period of time, that's going to be difficult. The tragedy is it's the elderly, it's people who are vulnerable in our society, who have multiple illnesses, children, and we need to make sure we've done everything we can to both trace the virus and to tell everyone they've got to wash their hands, not touch their face, and obviously be very careful around the workplace.
Safety must always come first, but it's not completely black and white. At what point does a precautionary measure possibly cause more harm than the virus itself? If we see schools close, parents have to find childcare, maybe long-term childcare. That is a burden that falls disproportionately on low-income workers. If that becomes the case, what can Congress do to help?
Well, first of all, there are so many workers, though not necessarily in Seattle working for Amazon, who don't have paid sick leave or don't have family leave or don't have alternatives for their children if schools close. So government has to step up, communities have to step up and find a way to cover those workers during that period, because they clearly will have to stay home with their children. And it is going to disrupt the workforce, but there are things we can do. Some of them are financial and some of them are institutional. We're about to pass a very large supplemental bill to help cover a lot of the costs, not just of research, but state and local government costs, particularly for the public health departments across the country. We have to make sure that insurance companies are going to reimburse people for their health care costs associated with testing, for example, whether it's a private insurance company or whether it's the government insurance company. There's lots that we can do, and a lot of these things are beginning to be put in place. We're behind the curveball, but we need to move now and to move rapidly. I am particularly concerned about those that don't have health insurance, that don't have good workplace benefits, because they will have very few alternatives. And once we start, if we have to close schools, if we have to close workplaces, this is a disaster for families in our country, but more importantly, we have to keep everyone safe, and that means following up, people taking the precautions we're asking them to take and that the public health officials are asking them to take. But let's leave it to these very good scientists, physicians, and public health officials to give us advice on these subjects.
Thank you. Thank you for joining us. Thank you for making that consideration a top priority. A lot of businesses and events have insurance to cover when they cancel things, but we must think about the trickle-down impact on working families, freelance workers, shift workers. It's going to disproportionately hurt them.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.